Hey, it's Dr. John here again. Got a patient that came in and, as you can see, had a pretty bad looking toenail. So I decided to go ahead and numb up this toe. I wanted to show you the technique that I have again for numbing up a toe. Most of the time when we're thinking about an injection, you think that the faster we do it, the better it'll be and the less pain I'll have to be in. But the truth of the matter is, the slower that injection is done, the patient a lot of times doesn't feel a thing. In fact, this patient, after we were all done, said, is that it? I didn't feel a thing. And again, the cold spray there is ethyl chloride. That is a spray that essentially evaporates so quickly that it freezes skin temporarily, which then allows for that needle to go in without causing too much discomfort because it temporarily numbs the skin. So again, we're injecting both what we call the lateral side, which is what I did first, and now I'm injecting the medial side of this big toe. He came in and he said that he stubbed his big toe. As you can see, it was pretty thick and probably already a little bit loose from the fungal infection there. So we decided to go ahead and remove it. So I'm putting on a Digicot there, which is a temporary tourniquet that'll keep this area from bleeding unnecessarily. And I want to make sure that I'm really being careful to loosen up this nail without damaging the nail bed or the matrix, which is right there. I'm essentially loosening up that skin that's holding the nail in the most proximal aspect, which is what we call it. And again, the skin is what is essentially attaching to that nail. The nail is really attached by almost like really tough skin. So all we're doing is loosening up this little layer of skin from underneath, and then that nail will be much easier to remove, and it'll keep us from damaging the nail bed. Because if we damage the nail bed or the nail root, the nail can come back thickened, and that is a permanent deformity, unfortunately, a permanent damage that can happen. So again, we're taking the hemostat, gently just pulling it off, almost like a bottle, tab on a Coke can, and I'm just gently taking that off, and there you go. I mean, came off pretty easily there. And of course, we've got a lot of this dead skin around the toe, and we're going to clean up any of this remaining loose skin and debris. And again, just to make sure that there is no infection, I'm applying alcohol to the base, to the nail root area, just to make sure that there's no bacteria that can still harbor. He is going to be on antibiotics afterwards, and just to make sure that this heals up properly. This should heal within a week. This was not a permanent procedure, as you've seen some of my prior videos where we removed the toenail permanently. This was just a temporary removal. And again, we'll remove the tourniquet, make sure that there's no bleeding. I usually give it a couple of seconds to make sure there's nothing that's bleeding or any bleeders that occur. Last thing a patient needs is when they leave the office to have a bloody bandage that was bled through. And now I'm going to be applying Amerigel. Amerigel is a specialized wound gel that you can actually get right on the internet. I'll put a link in the description where you can purchase it. It's great for wounds, open sores, cuts, scrapes. It is a fully, really more of a natural antibiotic type of ointment made from an oak extract. And I've used that for years for my nail procedures. It is a wonderful product. Well, I hope you all enjoyed. Again, another wonderful nail video. Look for my next videos. Hey, hit the like and subscribe button. I would appreciate it. It would mean the world to me. Take care.